Vaccine hesitancy remains a challenge for battling the COVID-19 pandemic. That's according to the Ghana Medical Association and the Ghana Registered Nurses and Midwifery, who are this morning holding a press briefing on the need to improve the situation. Let's take you live to Korle Bu Teaching Hospital for the latest. We'll try and get you back to the Korle Bu Teaching Hospital and get a live. All right, so I'm told that the live feed is ready. We can go to Korle Bu to witness the press conference on COVID-19 vaccination.
All right. Whew. I think, please, you want to speak to? Please go ahead. Abigail will be addressing your question shortly.
Thank you very much. I think Dr. Da Costa is trying to retrieve some information about the number of health workers in Ghana, so we'll get that. Our estimation is that we have about 200,000 health workers, and so we would get the confirmation. But when it comes to infection of health workers in this recent surge of COVID-19, I think we don't really have all the figures available at the moment, and if we give any figure, it may not be a correct figure. And remember that for us as health workers, we are always happy to declare that some of our staff have been infected. It doesn't mean that we are the only ones who are getting infected. It's just that even within the population, there is a lot more people infected than even the health worker groups. But we don't have the actual numbers. Hopefully we'll put the numbers together. We've done that in the past. Now that we are having surge in the number of cases, you will find both the GMA and the Ghana Medical Association putting these numbers together and then telling people how many of our people have been infected. It is to our own advantage. I am sure you are aware that we would always push for frontline health workers some form of allowance, isn't it? So we like the figures. We even like it more than the person asking, because it is good for us when we use those figures to justify why our work is a risky one and that somebody has to look at us. And indeed, it is a risky job, but we don't have the numbers. So, Dr. Da Costa, if you have the figure of about the total number of health workers, it will be fine. The 40% that we talked about is actually not sacrosanct. This is a rough estimation of the number of health workers who have actually been vaccinated. That we would, through these projects, probably we will come out with the actual numbers and the figures, but it is quite substantial. And I can say that it's higher than what exists within the general population. Thank you.
Thank you, Dr. Da Costa, says I should take that one. So having done some checks, what we've identified is that when you take all health workers on the Controller and Accountant General's payroll, covering the public sector, we are about 180,000. That excludes private sector. And yet, you know, in the private sector, we have a whole lot of health professionals as well. We don't have the figure now. But if you strike the 40% against that 180,000, then it means that we are talking about 72,000 thereabout. So this is a very important figure, and we need to work hard at it. Thank you very much.
Thank you, Madam Perpetua. All right, Dr. Da Costa.
Thank you, President Perpetua and Dr. Frank Shembo. I think I'll just give the update on the number of people who are fully vaccinated and the others. So I'm looking at our dashboard, and we have about 16.5 million being the doses that we've given out. Out of this, we have about 10,352,000 taking at least a dose. This represents 45.3% of the 22.9 million population that we want to vaccinate. Then we have 7 million, above 7 million as people who are fully vaccinated, and this represents about 31% of the 22.9 million. Then also for the booster doses, I think we have over 1 million. We have about 1 million people taking the booster doses. But I think the graphs of the matter here is that from the statement from the president of the GMA and supported by the JRNMA, there is more work to be done. In fact, those times we were talking about vaccine, the supply chain challenges and others. Now, I want to assure Ghanaians that we do have the vaccines available. And it is important that we all get vaccinated to get our lives back. Because should we fail to do this, then it means that at some point, if the cases continue to go up, when we'll be talking about the next wave, then it could be detrimental to the progress that we have made. And this is where you saw restrictions, lockdowns, and the other things. So we are only advocating and pleading with all Ghanaians to get vaccinated. And it's only that even the Johnson & Johnson now is second, you have to get your booster dose. So we want you to be fully vaccinated. And as you have gathered here, now let me also say that for the media, you play active role in this. I've seen a scale down of your activities in terms of COVID. And this is the time for us to plead with you that the disease is still with us. And you should continue to play your various roles to help us scale up the vaccination exercise. And let me also say that the face mask, the hand washing, the social distancing, and all the protocols that have served us well are still vital and crucial at this point. So we are relying on the media, our traditional leaders, our religious leaders, and all stakeholders to help us scale up this vaccination exercise and create demand. Thank you.
Thank you.